Welcome to the M&M Lab of Regenerative Medicine, where modern biotechnologies are investigated.
Follow the journey of Dr. Maha and Dr. Monica in discovering the successes and downfalls of gene therapy.
Well, what is gene therapy? Gene therapy is the treatment of genetic disorders using a vector.
What is a vector, you may ask? Vector is a vehicle of transporting normal genes to add, delete, or change genes. The most commonly used ones are inactive viruses. Let's take a look at how it's done.
First, we put the genes into the viral vector. After the genes are put in the virus is injected into the bloodstream. The virus then travels to the targeted cell and integrates the carried genes into the cell's DNA. If the virus has successfully integrated its DNA sequence, the cell will begin to normalize its function.
There are two types of gene therapy. The first type of gene therapy is somatic gene therapy. Somatic gene therapy is used to alter genes in the somatic cell of a single individual. The second one is germline gene therapy. Germline gene therapy is used to alter genes of the egg or the sperm so that the future generation of the individual is not affected by the inherited disorder.
You know, I don't really think gene therapy is a good idea.
What do you mean? Of course it is. It can help us so much. Gene therapy is so far the most successful treatment there is in treating genetic disorders. This therapy will not only help the individual with the genetic disorder, but also prevent the children of the individual from inheriting the genetic disorder. Moreover, gene therapy will help give people with genetic disorders a sense of hope, and after they proceed with the treatment, it will let them participate in normal daily life activities. Yes, gene therapy is risky, but just like you give chemotherapy a try to cure cancer, though it's not 100% guaranteed, we have to let gene therapy a try so that scientists can see if it actually works on individuals and generations over generations.
Well, I'm not too sure about that. Gene therapy may be seen as revolutionary to some, but there are too many consequences, hindrances, and risks for it to cause more healing than damage. If gene therapy becomes a widely used method of treating disorders, it will expand to more than just medical treatment and will thus be used carelessly, going against many people's religious and ethical beliefs. Health-wise, it is unsafe for us individuals, and as a population, we are no better off either. Changes in allele frequencies due to gene therapy will soon accumulate and lead to disastrous results.
Germline gene therapy targets the reproductive cells of the individual so that any changes made to the DNA will be passed on to the next generation. This will help prevent the offsprings of the affected individual from inheriting the genetic disorder his or her parent has, and thus allowing the individual to live in peace and not blame themselves for the condition their children have. For example, William's family has had hemophilia running in their family. We can use germline gene therapy to treat it so the future generations don't inherit it.
The problem with germline therapy in treating genetic information of eggs and sperms is that it has never been tested across generations of humans before. Sure, it is possible to see how it affects organisms that have shorter generations, however, that will not directly translate into the effects within humans. As a result, there may be unforeseen and negative consequences that may affect the humans of the family for the worse. Take the Williams family again. If they were to treat their eggs or sperm using germline gene therapy, one of the major consequences could be altering other genes that were not targeted. Think of it as a big pair of scissors. You need to make cuts at the site of the abnormal gene, but you might accidentally cut another part as well. Now, there are not only multiple genes that are abnormal, but those other genes could have been preventing other possibly fatal diseases from surfacing. Gene therapy is an immoral practice. From a religious point of view, it is being used carelessly as we are trying to take on a role that wasn't meant for humans. Gene therapy may help medical cases in the present, but it will soon after lead to many unintended uses. We will want to play God and choose for traits like skin pigments for future generations, which is unnecessary as it is merely for aesthetics rather than preventing the passage of life-threatening disorders. God is seen as a superior being within many religions. By pretending to be God, we would be going against many people's beliefs. For instance, in Christianity, the Bible states, "For I know the plans I have for you." We are not supposed to be choosing things like how our children will look before they are even born.
Blonde hair, blue eye.
That is not supposed to be under our complete control.
If that was the case, then even cosmetic or plastic surgeries can be called illegal as it is used for altering the human body. This can also be seen as playing God and risky, but it doesn't stop people from doing it. Additionally, it's up to the parents if they want to edit their unborn child's genes. Similar to how they make their child's clothing choices for them until they're old enough to choose for themselves. From the time the baby is brought to life, the parents are their God, because they are the ones who give the baby shelter, love, food, and education, all necessary for baby's survival and success. They have to trust the parents' decision and know that what they're doing is best for their children. Gene therapy will help replace or fix the damaged gene for the genetic disorder, thus allowing the individual living with a genetic disorder to have a normal life. For now, the therapy has to be repeated to prevent future mutations for that specific disorder, but it's better than people suffering from it. Aside from treating genetic disorders, gene therapy can also be used for cosmetic alterations of an individual so that they feel more comfortable in their skin and have a higher self-esteem. Yes, the treatment is expensive, but does it cost as much as the cost of a human life?
I can't play with my friends because I have hemophilia, and my mom is scared that I'll get injured and I'll not stop bleeding.
If this child were to have gene therapy treatment, then she will be able to participate in normal daily life activities like playing with her friends.
However, Dr. Maha, somatic gene therapy is not miraculous. It doesn't cure the disorder the moment the virus delivers the correct genes. The effects are short-lived, whether it may be kickstarting the production of a certain protein or suppressing the growth of a tumor. It doesn't matter, it's not going to last long. For instance, one of the most commonly used viral vectors is adenovirus type 2. This virus doesn't integrate the gene into the DNA, so it needs to be repeated often. As a result, these patients need to take immunosuppressant drugs their entire lives, so their bodies do not reject the viruses used in their continuous treatment, similar to as one would with, for example, a lung transplant. So Dr. Maha, in the end, you're not only left with the fading effects of the treatment and lifelong medication, but also a huge pile of expenses. In 2019, a little girl began her gene therapy treatment, which costed it around $1.4 million. Over 25 years later, she is still undergoing gene therapy treatment, which now costs even more. Another key issue arises from the vector themselves, the viruses. In gene therapy, the virus directly interacts with the body, leaving so much room for something to go wrong. If the amount of viral particles injected is off, it can lead to deadly immune responses, as the white blood cells in the blood will detect and try to destroy them. If there is already another undetected virus that is in a state of lysogeny in the body, any interaction between the two viruses could cause them to combine. And since the virus has some of its original genes, if it does combine, there could be some very serious problems. For example, Jesse Gelsinger was the first of many to face the consequences that resulted with problems from the virus. He had a mild form of a genetic disorder that hindered his body's ability to get rid of pneumonia. He lived normally by treating it with drugs and a proper diet. However, when he participated in a clinical trial in which adenovirus was used to deliver the correct gene, he had a severe immune reaction. In the end, a person who could have lived a normal life had died because of the viral vector in gene therapy.
But, Dr. Monica, scientists are looking at non-viral vectors like naked DNA, which are free of a protein called histone. The naked DNA is passed on during transformation of the cell. When naked DNAs are used in gene therapy, they will be taken out before the transformation and inserted with the appropriate genes within a virus into the bloodstream. This will change the cells of the body with the appropriate genes and replace the mutated gene. Another type of non-viral vector that is used in the treatment is called the transposon, which is a DNA sequence that can alter its position in the genome. Scientists have found success in transposons because they are not as risky as the viral vectors and has the long-lasting capacity of doing its job. Therefore, non-viral vectors will help treat the individual safely and more effectively so that people don't get scared of the treatment and leave the genetic disorder untreated. Gene therapy gives hope to people with genetic disorders that have no cure. There's been a success with Ashanti De Silva's case, who was born with a type of severe combined immune deficiency that creates mutation for an enzyme called adenosine deaminase. ADA enzyme plays an important role in keeping our body resistant to diseases. Ashanti was treated with gene therapy at the age of 2 by inserting the ADA gene into a vector and then inserting the vector into her body. This treatment was repeated every 6 months to make sure that her immune system gains better resistance and starts producing more ADA enzymes. Before Ashanti received her gene therapy treatment, her T cell count was very low. After her gene therapy treatment, her T cell count went up and gained resistance to the disease.
But, Dr. Maha, even if gene therapy has the potential to help many medical cases, it isn't widely accepted by the public. People are scared to undergo this type of treatment. In the news, they hear about viral epidemics such as Ebola and the millions of deaths that result from it. They don't want to put something that originally had such destructive power into their bodies, and rightfully so. Trials are beginning to leave the genes inside the virus that allows them to reproduce. So if something goes wrong, it will spread quickly within their body, and the people have risk of dying. So why would someone want to insert something so dangerous into their body? You have hemophilia, correct?
Yes.
Well, I see here that there is a clinical trial where they will use the HIV virus to deliver the correct genes into your body. Do you want me to sign you up?
No, I don't want to put a virus in my body because I'm scared that I'll get hurt.
Also, Dr. Maha, fast forward many years in the future, if gene therapy were to become an accepted and easily accessible method of not only treating disorders, but for also physiologically and cosmetically enhancing the human population, it could cause an effect that is similar to a genetic bottleneck. In this scenario, it would essentially be a small group of scientists that are artificially selecting for alleles that they believe will help us survive better in the short term. Combined with the influence of societally glamorized traits, only certain alleles will then become more frequently chosen. Allele frequencies will thus change. The so-called bad or undesirable ones will be reduced or possibly eliminated, and the ones that people would like for the future generations would increase in frequency. This will cause a problem in finding relationships between alleles. For instance, sickle cell anemia is defined by 2 abnormal genes. When an individual inherits one normal and one abnormal gene, they are provided with resistance to malaria, which would help them survive. If we get rid of other alleles that we think are bad, we might lose the ability to find relationships like these, which would ultimately help us rather than hurt us. Overall, the genetic diversity of our population will be reduced by drastic changes in allele frequencies, thus leaving us susceptible to epidemics that we, as a species, were normally able to survive due to being genetically diverse. For billions of years, evolution has been at work to optimize our genes and frequencies. What makes us think that a small group of scientists, no matter how smart, could do a better job than it without causing a huge disaster?
No, Dr. Monica. Humans have already become vulnerable to genetic disorders as more and more generations are inheriting it, and there's no action being taken to improve the treatments for it. Do you think we should use gene therapy for cystic fibrosis? Yes, we should.
No, we should not. Definitely not.
Well, what are we going to do then? Just like I previously stated, it's up to the parents if they want their children to look a certain way, and if they know they can afford it, then they may as well do it. Gene therapy is altering allele frequencies in a good way, and it's the best shot we have for curing genetic disorders in individuals and in future generations. It's now or never. Gene therapy will need to be made legal because until trials can be conducted on individuals with genetic disorders, we cannot hope to accomplish any success in an individual or on generations. Gene therapy is the best outcome we have for curing genetic disorders. It is better to have some downfalls now than have millions of people suffering from genetic disorders and being scared to perform normal activities that normal people do.
In the end, the risks of gene therapy outweigh the benefits. Gene therapy will start our slide down a very slippery slope. Any action done now is not without consequences. It could become abused later on for anything and everything, from cosmetic alterations to physiological enhancements, no longer just genetic disorders. We would want to take over the role of crafting human genes like clay. In reality, genes should not be manipulated as such, because it is unethical and goes against many religious beliefs. The components of gene therapy itself can be very harmful. There is too much room for error when using things such as viruses. And, over time, the effects of gene therapy will accumulate if we were to alter allele frequencies of the gene pool of the human population based on what we like rather than what is best for us.
Well,